I just want to say welcome to everyone, those in person. Yes, thank you. Thank you. Those of us in person and others of us that are online.
Yes, she's, I guess, you can start.
Okay, let's begin. Okay.
Has to be closer to. I'm sorry, that I can.
So volume check.
Yeah.
Is that good for everyone? Thought I was loud enough, but
Well, that's true. You didn't start yet.
my tech buddy says, nope, I'm not loud enough. Okay. So again, good afternoon, everyone. Thank you for joining us. This session is Empowering International Medical Graduates. And we're specifically looking at how adult education can assist this group in navigating US job market challenges. So I just want it to be clear that when I talk about IMG, I know there are some folks that may not typically use these letters. They are referred to international trained professionals as well. But specifically, this term is actually used for those that are specifically within the healthcare field. So if you're used to ITPs in medical careers, then that's also the same group that we're referring to. So for the rest of the presentation, I will refer to our group as just IMGs instead of giving all these long words, right? So let's get started. I think I broke it. It was working just a second ago, but let's keep going. Here we go. So I'm going to start with one of our doctors. So we're going to call her Dr. Ella Kaya. She's from Istanbul, Turkey, and she arrived in the US filled with hope and determination. For over a decade, she had been a respected internist in Istanbul, diagnosing complex cases, mentoring young doctors, and making life-changing decisions. But in America, she found herself in an unfamiliar position, starting over. She had come to join her fiancé in Rhode Island, believing she could swiftly transition into the US medical system. What she didn't expect was how grueling the path would be. Her first challenge was the US medical licensing exam, or USMLE, which is step one. There are 2 or 3 steps depending on your specialization. Now, despite her years of experience, the test required mastering an overwhelming amount of basic sciences, much of which she hadn't studied in years. She spent months buried in books, sacrificing sleep and social life. When she finally sat the exam, she walked out feeling drained, but hopeful. She anxiously waited for the results as minutes turned to hours, hours turned to days, and days turned to weeks. Weeks later, the results arrived. Pass. Wonderful. She was one step closer. The excitement was heavy, but she refused to slow down. She registered again, but this time for step 2. This time, she felt more prepared, realming from the confidence of passing the step 1 of the test. But when the results came in, her heart sank. She failed, but just by a few points. Even though she was disappointed, Ella could not give up. So just want to give you, just introduce myself. So good afternoon again, everyone. My name is Dr. Cheryl Buchanan. And just some background, I've been in adult education for over 12 years. I've served in various capacities, but my initial introduction to adult ed was as a volunteer with a citizenship preparation class. So since then, I've moved to pretty much most of the areas. So I've done GED, ESL, IET programs, and I currently serve as the education director at Genesis Center, which is a community-based organization out of Providence, Rhode Island. Education-wise, I've been a lifelong learner. As you can see, been in school for a while. And so I kind of feel that that helps me to relate to my students as they continue their educational journey when they migrate to the US. So just want to give you an idea of what we'll be reviewing today. We'll be looking at the background of who and, who are IMGs, what makes this group so special. We look at the research that was done, so we'll do an overview of the thesis and the findings, and then what can we use that information to do? Now, how can adult education actually help our IMGs to focus or to find a job in the US? And then finally, I'll give some information about what is being currently done in Rhode Island. Best. So we'll quickly go to who are they. So as I mentioned earlier, we are referring to this group as international medical graduates, so IMGs. So these are individuals that receive their medical qualification in any country other than the US or Canada. So if you should go looking for the definition, it has nothing to do with a person's citizenship or nationality. It really has to do with where they did their training. They're also referred to terms like foreign medical graduates, overseas trained graduates, internationally trained physicians, or internationally educated physicians. So there's a myriad of different terms. But when we break it down, these are all individuals that were in the medical field, that they did their training, their practice in another country, has now migrated to the US, and I said, or Canada, and is now looking to continue their career now that they are residing in these countries. So, two interesting facts. In the US, about half of IMGs who apply for residency are denied a position. Half. And statistics also show that 24 to 25% of current practicing physicians in the US are immigrants. So this is not a new concept. And these are folks, they are folks that have made the transition. But we still do see a lot of difficulties that they face. And so what can we do to help this specific group as they try to transition into the field? So background information, it's a lot of information here, so I'll just give you a quick summary. Our IMGs are not a new group to the US. If we trace back all the way to, I would say, World War II, there has always been steps to actually get groups of physicians to come to the US to help with the shortage that we have. And I'm not sure about, well, the last time that I checked, I must say, and that was up to about a month ago, there is a considerable shortage of physicians, medical professions in the field, right? So we literally have a national shortage, especially in developed cities and towns. And so the question begs to be asked, why do we have such a large population of qualified medical professionals that are residing here and some actually working, that are not able to actually continue the practice? So let's keep going. So the research or the information that I am going to share with you further are all factual information that has been taken from research that has been done over the past few years. So all the information and the stats shared is information that's been gathered within the last 5 years. The results and the suggestions that you will get are all based on research that has been conducted was conducted and concluded last November. So please make some notes. We are going to have some little pop quiz popping up. So I would encourage you to make notes of these interesting facts. So in the US, again, there is a shortage, and it is shown that by 2030, there will be a shortage of 100,000 physicians, just physicians. And I don't know about you, but that number sounds very staggering. And this is going to be especially in underserved areas that this shortage will be experienced. Talking about making notes, right? Here we are. So we are going to start with, we are going to have a few more of these. So we're going to have to switch over. So I'm going to switch over. We're going to do a quick quiz of Kahoot. I do hope that we are familiar. If you're not, we're just going to give instructions. My lovely assistant Laura will help me with that. You can give instructions and I'll pull it up. Why is this here?
Do you go to the link?
I'm just doing it there.
Okay, so what you're going to do once a QR code is going to show on the screen is just take your cell phones out and open the camera and just aim it to the QR code and it will open to the game directly. If not, you can go to Kahoot.it, that is KAHOOT.IT, and enter, you need to move your, yes, thank you, and enter that game pin. So either way, Kahoot.it and enter that number that you see on the screen is 5380776, or just scan the QR code either way. Who played Kahoot before? Yes?
Anyone? Okay.
Okay.
Perfect.
So I don't need to explain how it works, right? I'll join the COABE one, COABE 25.
All right. I do see a lot of faces. Can't say cute, but they are coming out. Combination of faces. So let's get started. We will have a few more join in. Another few seconds. Do a countdown. 10, 9, no. Okay. You are still able to join during the game. I just want to remind everyone, while it's important that we're doing for accuracy, with Kahoot, it's a combination of accuracy and speed. So just want to warn you. And yes, but if you answer too slowly, then you won't get the point. I think that's everyone. All right, so let's start. All right, so what do we need a sound? Oh, I am sorry. That's it for sound. The meaning of IMG is international media graduate, international medical graduate, Intel medical graduate, or ice mango gummy. Oh, there we go. All right. Quickly go to the next one. Number 2, what percentage of practicing physicians in the US are immigrants? It's 15 to 18%, 24 to 25%, 30 to 35%, or 10 to 20%. We have 8 seconds. And time. Let's go next. True or false? Only a quarter of IMGs who apply for residency are successfully placed. True or false? Only a quarter of IMGs who apply for residency are successfully placed. 2, 1. Oh, numbers are coming up. Another true or false: international medical graduates can be significant in resolving shortage of medical professionals in the US. True or false? or IMGs can be significant in resolving shortage of medical personnel. All right, overwhelming. Huh? What is the anticipated amount of physician jobs that will be available by 2013? Is it 100,000, 13,000, 98,000, or 130,000? What is the anticipated amount of physician jobs that will be available by 2030? All right. Was that the last one? Yes, it was. So, Kelly, third place. Nicely done. And we don't have a name for that one. Our number one, Rebecca. All right. The sun. Okay. No one in first place from here. Okay. Rebecca, congratulations, Rebecca. All right, so let's go back to, so nicely done. Nicely done. We will be handing prizes out at the end, so please. Yes, we're not going to do that. All right, so let's get back to. So lovely job, everyone. Let's continue. So now that we have successfully passed the first quiz, let's keep moving. So I had hinted at the fact that this presentation is specifically based on research that was conducted and conducted and concluded in November of last year. So when the research was being done, there are three main questions that were asked, and this was the focus of the research. One was, what specific language-related challenges do IMGs encounter during their job search and integration in the US healthcare system? The second one was on the financial difficulties that impacted their career prospects and their employment experience in the US. And then the final question was, what experiences actually motivated them to kept up or to keep going, even though they were faced with these language and financial obstacles? So we really wanted to fully understand the grasp of what's those language problems, what's the financial problems, and how and why are they continuing despite these significant issues? So let's take a look at what we found. So I just wanted to share that the motivation, so I actually looked at what is it or what is being said about self-determination. What's the theory? I actually focused on self-determination theory. And this theory actually says that all individuals do have three main things that keep them going. Keeps them going. The first thing is actually having that feeling of choice. They want to be able to choose and to be able to choose and be willing to endorse their own behaviors. They're adults, so they want to have that option to do what they find most interesting to them. They also want to get that experience of mastering and being truly effective in what they choose to do. And then last but not least, they want to experience that sense of belonging because they can find other individuals that are as experienced, that have as much knowledge as them, so that they can actually be worthwhile and they can feel a sense of belonging and do good for others. And so even when the obstacles are really great for this population, just that need to help others kept them going. And, after going through the research and doing the interviews and so on, it was quite remarkable to see after so many obstacles that they didn't quit unless they had to, right? Because of circumstances that were outside of their control. So main points from the findings, it was found that we do have many IMGs from several or different parts of the countries. In the interview specifically, we had individuals from Turkey, which was the story that I started earlier, and I'll let you know what happened with her. We had individuals from India, the Dominican Republic. We had a student from China. And we also had a student, well, a few students from Colombia as well. Now, they are really motivated, as I mentioned, in globally recognized for an opportunity to be working in a globally recognized medical system. Even though they had the language difficulties and they have issues with cultural adaptation, they wanted to be effective in what they're doing or what working. And so they didn't have any issues with going to classes to do that, that extra practice, going to classes to learn how to communicate effectively with new patients. These are all of the things that they understood that they had to do. And even though it's a really rigorous process for our IMGs, they understood that everyone's health is important and they wanted to continue through with it. So after actually going through and getting their certifications evaluated, then the next step for them is to complete a licensure and certification requirements. And this include the USMLE, which is the US Medical Licensing Exam. They also had to do other certifications. And it's at that point then they would be qualified to do or to enter into the matching program for residency. And the residency usually takes about 3 to 7 years. And this is despite their years of experience. So even if we had a doctor that is newly graduated, or if we had someone that has been in the field for 10, 15 years, it was the same time period that they were required to do, or is required, because it is still in place, that they are required to do. And every step of the way, there is a fee, as much as 1,500 for the USMLE exam. So they have been experiencing significant financial, I would say, challenges because of these fees. I do remember interviewing one of our candidate, and she mentioned that at this point in the journey, she has spent over $15,000. One second, because we wanted the others to hear. That's okay.
Not only do they have to pass these two license,
Right.
but then they still have to apply for residency. So they still have to apply for a residency program.
Right. So love the question. And so after they've been approved, so the first step is to actually get their degree evaluated. So not all IMGs would qualify to resume their career here. They have to actually get their full transcript and check to see if their college or university is on that list. Oh, sorry. Let's keep the mic. Go ahead.
I know that there's a national, association that does, the evaluations. But
Right.
for the medical field, is
Right.
there a specific agency that has to be used, or does it matter?
Yes. So it depends on what their so if it's for physicians, there is a specific list for physicians, for nurses. So it really depends on their specialization or where they want to go. And that will determine what organization that they'll use. And in addition to that, it also depends on the state that they reside in or they want to practice in, because every state has their own qualification in addition to what is required at the federal level.
Texas.
For the state of Texas, I'm not sure, to be honest with you, but I can get the information because I'm out of Rhode Island, so. But I can definitely source, at the end of it, I will give my contact information. So you can definitely feel free to reach out. I know there was a presentation this morning specifically about this type of work being done in Texas. So, but I can definitely get you to the right source if you are willing to if you need information on Texas. So I love these questions. Yes. So it was, and thanks for bringing that up. So it was a hybrid session. So I don't recall the name of it, but I can look it up at the end and I can share that with you because they did share the PDF of documents and so on. So
4 students right now from Mexico that are physicians.
right,
And it's like, I don't know what
not
to do
sure
with
what
them.
to do.
I don't know what to do with them. Some of them, 2 of them had decided that they didn't want to
Yeah.
continue because they're retired. So
Right.
they don't want to do, you know, that whole process. But my other 2 are pretty young.
Okay. All right. So we'll definitely connect to get the information. Thank you. All right. So the information that is gathered here, it was collected in 3 different ways. So I did one-on-one interviews, we did a post-interview questionnaires, and we also did a focus group session. All the findings are listed here. So we had 4 main things that came out after going through all the details, all the answers. So their main challenges were language, external barriers, expenses, and support system. And then these were further broken down into sub-themes. And let me move this over so we can see them a bit clearer. It's good? Okay. So when we talk about language, we are looking at language improvement, their needs, any resources that they found useful, and resources that they needed. It was very interesting to me because I think a lot of times when we think of physicians that are here, many folks usually think that, oh, they need ESL. And I must say to you, this is not true. What I have found, or what we, after doing a lot of, the research, was most of our physicians that, especially physicians that come here, they actually did English classes in their country, right? It was quite peculiar to me because a few of them mentioned that, yes, I did English and I was actually at the advanced level in my country. But I remember one of our physicians saying that, once I got out of the plane, it felt like I heard people talking and it felt like they were talking like gibberish. They were like, I don't know what happened, but somehow the English was different from what I had learned, right? And we know from, if you have been in adult ed and you've been in the ESL classroom, it's not always that they don't have the ability to speak, it's confidence, right? And it's just getting that ear for accents and just intonation and stuff like that. So I want to encourage us, like, don't think that, okay, they're going to need years to learn the new language. They are, many of them, because as I mentioned, I did interview folks that are from India, and one of their official languages is English. So they are able to speak very well and understand it. But even those individuals ask for language assistance. And for them, it was mostly to review vocabulary, like medical vocabulary, right? Because they know the meanings, they've been doing this work. But there are some terminologies, so medical code, terminologies that are different. Those words are different here. So just to give them and help them to get to learn the vocabulary, things like communication. So verbal, nonverbal, we know that as medical professionals, they are going to be talking and having conversations, and they need help to make sure that they're communicating, able to establish a relationship with us. So they need to know what are words or what are terms that should be avoided. Am I using words that could be considered disrespectful? Because you want to make sure that your patient feels supported at all times. Then we looked at external barriers like their family, the lack of information. And as the question was asked earlier by one of our in-person participants, like, where do I go to get the information if I'm a physician and I want to reestablish my career here? Unfortunately, this information is not easily found. And what complicates it more is the fact that every state has its, own requirement. So some may need more, others may need less. And so that is one of the needs that was identified too. So basic needs, they still need to eat, still need to support their families, still need to pay rent. So all of these things, and job status. As I mentioned before, the process gets very expensive. And so we have individuals, especially if they have if they have a family that needs to find jobs that are at least at the mid-level. So if they're starting at entry-level positions, the pay rate is so low that it doesn't support them as it should. And as international graduates, as IMGs, when they pass the exam and they actually apply for residency, the types of job that they did before, the types of jobs that's on their resume, actually can affect their strength of application. So if we have an individual that comes here and they start working in housekeeping, and please, I am not putting any jobs down, right? But I just need us to understand that if the position that they take does not relate to the medical field at all, it weakens their resume. Because they will now have to convince these hospitals or wherever they apply to that even though I have not been working in the medical field, I am still up to date on what's happening, right? So our IMGs need to keep working within the medical field. And because they have basic needs, because they have responsibilities, they need to find jobs that's not only helping with making sure that their basic survival, but also ensure that they keep it up to date with all the medical changes and information and updates. As a matter of fact, I had one of the participants that shared that she found a job and she was so excited that she was working, but because it was an entry-level position, her paycheck that she brought home, because they have children, she ended up having to rely on her husband for extra funds. So he had to make up her paycheck to pay for childcare. So it ended up actually taking more money from that family, right, from that family income. And so she was forced to quit her job and stay home with her younger child until her daughter was at school age. So once she started attending school, then she could put her on the bus in the mornings, then get a job that would provide some support while they are at school. So it's really complicated for them. And then that brings us right into expenses. And that included the cost of the exams and applications. We looked at ways in reducing the expenses. So some of them shared in the winter time. If they're in the north, I know this was done in the northeast. So in the winter time, it gets very cold. And, one of our moms shared that, whenever my kids leave for school, I would walk around the house and I would turn the heat off in every room to try to minimize the heating bill, right? And she said she would go around and she would ask her neighbors if they got coupons, and she would cut coupons out to help with getting groceries for the kids, because they're growing kids. They eat. And if you have a little boy, then we are growing, they tend to be more rambunctious when it comes down to food, right? So it's really it was really a reclining. They had to really try to balance it out so that they can get back in the field. And also, what are the support systems that are available? And that would include just helping them to know where to go to get the information to apply. They would need to know which exams they need to do. They would need to know where to go to get classes. They would need assistance with wraparound services. So finding childcare, thinking about updating, keeping their resumes updated. If they needed public transportation, how do they get that? And so forth and so on. And self-efficacy, how do they stay motivated even though it seems like everything is against them. So I always like to break down information and like put it on charts and bar graphs, because I feel like this helps us to, have a better image or idea of what it looks like. So here on this slide, we're looking at the struggles that they encountered on this line graph. So here we have most of the individuals that were interviewed, so we did 10 in total, and of the 10, 6 of them mentioned that language was a need for them. And like I mentioned earlier, not necessarily learning the language, but just learning the culture and learning how to communicate with patients in a manner that would actually establish trust. Some of them, they did mention financial help as, something that would be really important. And then there were a few that mentioned, you know what, my primary need is to network. So how am I able to, or where can I go to network with other IMGs so we can provide a support system for each other, and also get mentoring from individuals that have already been through the process and is there to pretty much be like their guidance. Not just to find internship and fellowships, but also, giving them some pointers on how to get through this process. And on this pie chart here, it represents the financial issues. So the question here was, how many actually experience significant financial issues, or if it was just, just some, or little to none at all. And if you look at the numbers here, it showed that 75% of our participants mentioned that they do have a significant financial issues. So a lot of information. I love to take breaks. I love to do Kahoot. So we're now going to our second pop quiz. Yes. Oh, what happened? Did I lose them? Uh-oh. Okay. Yeah. I apologize. Found you. Here you are. And Lara, I think you did an awesome job with explaining the rules, so we don't need it again. So let's see what we remember from all this information. We're just scanning the code. I don't like this music at all. I'm not a fan of this music. I understand, but then it gets in your head. It reminds me of the what is that song? Lamb Chop? Is it? Yeah. This is a song that never ends. Okay. All right, thank you. All right, so I'll give a few more minutes. I'm told that it was delayed for our online participants. Elevator music. Thank you. No? Oh, that's all the way up. And it's 100% here too. Yeah. Yeah, that's it. Think we are ready? I don't. All right, so let's get started. Do see quiet. Yeah, so these animals are cuter. Here we go. I love it. So let's begin our first question. 2, 1, here we go. What was the focus of the research study that was conducted with IMGs in Rhode Island? What was the focus? Was it language-related challenges, financial difficulties, motivational experiences, or all of the above? All right, this one is quicker. Here we go. Nicely done. Next question, some of the certifications and licensing requirements of IMGs include the US Medical Licensing Exam, Certificate of Medical Professionals, Educational Commission for Foreign Medical Graduates, a lot of words, or both A and D, which is USMLE and, okay, and the green one. Good job, everyone. I think we all got it though. Nice. True or false? There are 6 main issues that were identified in the study. True or false? There were 6 main issues that were identified in the study. All right. How was the data collected? Let's see. How was the data collected? Was it interviews and surveys, singing and dancing, surveys and manuscripts, or interviews, questionnaires, and focus group? Why is this number so big? Something went wrong with this one. We have a lot more time than we need. So thank you guys. Appreciate you. That would have been very bad, right? True or false? The results show that most participants experience hardship in paying the required fees and expenses. True or false? Most participants, all right, lovely. Let's see our winner. So in 3rd place, we have Norma. Woohoo! 2nd place, we have Kelly. Yay! 1st place, we have Bang. Nicely done. Woohoo! So just nicely done. That's Bang. All right, Bangs. I see you. Good job. So just want to let you know we have one more that is coming up, and that one you will be able to win prizes. So let me close this so we're not hearing any more sound. Yes. Oh yeah. So that one will be more difficult. Okay. So let's continue. Can't make it too easy, right? So we're doing good so far, everyone. Thanks for participating. So, oh, I'm so sorry, Jessica. So I wanted to share a quick video with us all. And this one is off an IMG, and just I hope the volume will be nice to us. Just want to give you an idea of, their experiences. So what's going on?
I'm a doctor. I was practicing in the Dominican Republic for 3 years. I came to Canada in January 2022. I came to Quebec. I used to work at McDonald's, and I was very grateful for that job. Many of us doesn't find jobs, so I was grateful for that. And now I'm working as a medical assistant, which I'm grateful too, because it's hard to get a job with a medical degree. As an immigrant, a lot of us international medical doctors, we are willing to work hard and to do what it takes just to get to our final goal. It's really touched my heart. I don't want to cry, but it's my passion.
And you want to be able to do it here.
I would love to give back as the government has given me, right? The sense of that no matter your color, your race, you are welcome, because that's also why I came here to Canada, because this image of it doesn't matter who you are, from where you come from, we will welcome you, right? It doesn't matter if you're struggling with whatever it is, we will embrace you. So that image of like being a family, that's how I end up here.
So even though this individual that shared, she is in Canada, I had mentioned earlier that when it comes down to our IMGs, Canada and the US has the same requirements, right? And it was when I found the video, I really had to share it because this was the story of everyone that was interviewed. Everyone that was interviewed, said the same thing. It's just being here. I just want to serve. I want to help people. And it's heartbreaking to see how much they have to go through to give back. So they're, to give back and to help us that are here. It's like their way of showing their appreciation. And so it was quite interesting to me when I interviewed, like when they shared their story about the hardships that they went through. And I hope that we were able to hear that when she started, her first job was a job at McDonald's. And the good thing for her was that she was able to find an organization that provided assistance for IMGs. And so the first thing that they had to do is actually rush to get her out of that job at McDonald's. Because the longer she stayed in that position, the more damage she would actually cause to her resume. So even though for her, she's like, I just want to work, I need to provide for my family, for myself, it was really it was really not the best thing for her. So what I have observed and what we've seen is that a lot of these folks, the best thing for them is to actually quickly find some type of training. And a lot of our IMGs right away do CNA training or medical assistant training, because this is within their, this is within their field. And so every job experience that they have going forward is actually helping their resumes, because then they're in the field, they're continuing to learn. And so when they apply for residency, because remember, well, residency is very competitive, right? And they're competing with students that are just graduating from US universities and colleges, and some of them are even younger. So we have everyone being placed in the same pool, first of all. And second of all, there are very limited organizations that accept training doctors, right? So here they are, apart from all the difficulties that they've experienced, they are now placed in a pool with other more, and believe it or not, within the field, those that graduate from universities here would be considered fresher minds, right? So they end up a lot of times looking more attractive because all their experiences, everything on their resume has been within the medical field, because they've been working in observership, internships, but they're also younger adults that started from, they finished high school, went straight to college. And so their entire time shows that they've been in the field and they've, been updated, having access to updated information. So it can get really difficult for this group. Now, I wanted to just take a minute to do a spotlight of the program that is currently being offered in Rhode Island. So RI Spotlight. And the organization that has been working with our IMGs in Rhode Island is the Rhode Island Welcome Back Center. And the Welcome Back Center was initially an initiative that started back in 2001 by Dr. Jose Ramon Fernandez Peña. And he actually, he saw the need for healthcare professionals that were here, and they wanted to provide service. They wanted to get back in their career, but they needed to find a way, or they needed assistance, guidance to get them back to that area. And so this center has been around again since 2001. There are 11 centers. So of course we have in Rhode Island, but there are also others in California, Colorado. We have in Massachusetts and Maine, Maryland, New York, in Washington and Pennsylvania. So these centers can be found, or locations can be found, I would say, all over the country, different states. But in Rhode Island, even though we're a tiny state, or the tiniest one, the center is also tiny. So we only have two staff members, and the two staff members is the director and the case manager, but we also get assistance from the Rhode Island Department of Health in terms of helping with operational support. Now, even though the center is so small, we have been able to get some, some good work done. So just for the year 2024, there has been 37 healthcare professionals that has been helped provided service, right? And of the numbers, we had 16 physicians, we have 11 nurses, 3 psychologists, we have our lab professionals, a doctor, physical therapist, speech therapist, speech therapist, and surgical instrument tech and a nutritionist. So they come in varied fields, but varied jobs, but all medical professionals from different countries: China, Colombia, DR, Guatemala, Haiti, India, Paraguay, Poland, and Turkey. So when we look at the services that the center has been able to provide, it's a bit unique because the center doesn't focus only on giving them information about where to go, but also focus on providing that financial assistance. So the center has been able to provide assistance with helping to pay for the USMLE. And again, I mentioned that there's step 1 and 2, depending on the area of specialization. Sometimes there's a step 3 to that as well. There are some states that require our IMGs to pass an English proficiency test, so like a TESOL certification. And it doesn't matter if the IMG is from a country that lists English as their main language, they still have to show that certification, right? So again, that is something that has to be paid for. When they apply for residency, that's another fee that is associated. And the last time that I checked the fee for that one, it was $150 for just for the application itself. And then there's a fee, extra fee based on if you add other hospitals as well. So you're charged based, so it's a fee of an application fee $150, and then if you apply to 3 different hospitals, you're paying $50 per, right? So that's an additional $150. And of course, if you're applying for residency, and as we explained, that you don't want to apply to just one, the wider you cast your net, right? The better chance you'll have of getting a hit. So that's what makes the Rhode Island Welcome Back Center unique, is that we've been able to provide the wraparound services for what they need. And as I mentioned to you with the resume, that was a big thing. A lot of individuals that came to the center was in jobs like in the factories, they were finding housekeeping jobs and so on. And so we had to really work on getting them jobs in the medical field quickly so that they can improve their chances once they get to that residency level. I'm going to pause for dramatic effect. Okay, so role of adult education. So here we are. When all this information is gathered, what do we do with it? What do we do with it? And so I do have a few things that I have listed here, policy-wise. I find it quite peculiar that we have this dire need of healthcare professionals, and we do have a large number of folks that are already qualified. They have already practiced in the field. So we really need to find ways to get both connected, right? So having a collaboration between the Department of Ed and that's the local. So within the states, we have that collaboration with the Department of Education, the licensing board. I need to pronounce this word correctly, right? To provide grants to our local programs. And this grant would actually help with the language courses, the exam preparation. I know in Rhode Island specifically, we do have an a class that we have for our IMGs, and it's really similar to an IET program. So we provide classes for the ESL component, and we also have a class that for those folks that have their English level is high enough so they can start doing their test preparation. So that's how we've been able to do that. And it's just to remember that there is no specific format that is one fit all. It really depends on the population or the group that you're with, and so you tailor it to provide what they need, right? Another thing that we found that would definitely be helpful to them is actually getting medical institutions involved. I know that in Rhode Island, on a weekly basis, within adult ed, we do get a newsletter that shows quite a number of jobs that are, that vacancies for jobs that are in the medical field. And so it would be nice if our medical institutions can collaborate with adult ed again, because we are the ones that are here. We're working with these individuals to get them into these jobs so that they can not only continue to practice in the field, but also to help individuals that do need the assistance, right? So our medical English proficiency, so we're looking at terminology, communication, cultural nuances. So we're looking at how do you communicate with others now that you're here in the US? There are certain things that is okay in their country of origin, but once you get here, the norms, it's different. The way that you communicate is different. The vocabulary that we use is different. So it's really important for them to get the support that they need in order to be effective. And so I mentioned help with test preparation, workforce readiness, professional integration. So again, helping them to find those jobs that they can do right now until they get back into the position that they were originally trained for. Providing financial assistance. It can be loans, because currently many of them don't even qualify to get a loan. Unfortunately, they don't qualify to get scholarships. And one of the recipients actually, our participants, sorry, actually mentioned that there are observerships. Is everyone familiar with what an observership is? Okay, so an observership is where it's like shadowing, right? So you are able to go into a medical practice, and it can be private or state, and you're actually shadowing a doctor. So if you're planning to be a general practitioner, you can actually go in and shadow a doctor for a specific period of time. There is no pay, but interestingly, this is a requirement on their resume when they apply, because they are looking at hours that you have been hours that you've been either volunteering, observing, and you do have the externships. But observerships are specifically designed for our IMGs or our international professionals. The issue is, even though they're designed for this population, they have to pay a fee to actually be enrolled in this program. Yes, it's a paid program, and it's usually depending on the state again, but I've actually been told that there was one. So one of the participants mentioned she saw one and it was 1,500. It's 1,500 keeps coming up, right? For the summer, for just the summer. So it was a 6-week observership, and it would be required for her to pay $1,500 to participate in the observership. So it's quite interesting. It's a lot of money associated with it. And I must say, I do admire this group because they do continue to really, really push, and they want to provide service. They want to be helpful. They want to be a part of the society, or want to have that sense of belonging, because this is my passion. So I have a question. Okay, thank you.
So, Tony asked, any ideas for students who have religious belief that prohibited them from taking out loans with interest?
Any ideas?
Who have any ideas for those students?
So if we have students that do,
They cannot
they
take loans.
cannot, well, to be honest with you, there are not many loans available. That's one. So two, what I found when I was having that discussion or doing the research was that unfortunately most folks just work and save. And as they save enough for each test, then they just complete the application. The scholarship is pretty much not really there, but that's the only thing. And I must say, here it is again, every state has different laws. So I would say scholarship would be the best alternative for these individuals that do have that. Credit card, oh, that's a sticky one, but that's also another one that can be used. Of course, we will have to teach them about the laws about, not the laws, but the rules around credit cards and making sure that they don't affect their credit, by using the credit cards too much and not having the funds to pay back for it. So again, if they have a credit, it's really sticky. We do have another Kahoot. So this is the big one. And again, I forgot to go back to home. I'm so bad at this part. I'm so sorry. So, so this one is the big one. It's more questions. So we're going to have 10 questions and we are going to have a prize for the top 3. So let me get this code up quickly for us. We're loading. Speed and accuracy. This is the big one. Is it 8 or 10? It's 8? Okay. So it may be 8 questions. Less pressure indeed, but let us see. We're done? All right, let's get it started. Oh, look at these images. Awesome. Never fails. Number 3, 2, 1. Here we go. 8 questions. Rhode Island Welcome Back Center also provides financial assistance for expenses such as credential reviews, write-in fees, licensing fees, or both A and B, which is credential reviews and licensing fees, right? Ooh, all right. Number 2, in 2024, how many IMGs were assisted? Was it 19, 37, 210, or 21? How many IMGs were assisted last year? And we have 4 seconds. Ooh. All right. 37, yes. True or false? Test preparation classes and IET trainings are 2 ways that adult education can support IMGs. So test prep classes and IMG trainings are 2 ways that adult education can support IMGs. True or false? Yeah. Oh, true. Oh, Brenda is ahead. What is the name of the doctor in the story? Is it Dr. Eddie, Dr. Mickey, Dr. Maria, or Dr. Ella? Dr. Eddie, Dr. Maria, or Dr. Ella? Okay, Dr. Ella. Getting close. In 2024, Rhode Island Welcome Back Center worked with IMGs from different countries, such as Turkey, Austria, Honduras, China, India, and Poland. sea, shore, and mud, or Ethiopia, Barbados, and Italy? Was it though? So China, India, and Poland. All right, Brenda is still ahead. True or false, the presentation today was beneficial. There is no wrong or right? True or false, the presentation today was beneficial. I have to put something in there. Oh, yay! Thank you. Brenda is still the one to beat everyone. Who is on the picture of the last slide of the presentation? We just had the picture up. Was it Mr. Bean, Dr. Phil, Celine Dion, or Puss in Boots? Which one? All right, Mr. Bean. Last question, it was 8. What do you believe is the most significant barrier IMGs face when trying to re-enter the medical field in the US? What is the most significant barrier? So a combination of, well, let me read all of the above. Financial burdens such as exam fee, limited access to US clinical experience, language and communication challenges, or all of the above? All of the above. That's a mouthful. So let's see who the winners are. In third spot, Brenda. What? All right. In second place, Cynthia. Yeah. And first place is Rebecca. Nice. Nice. So are all the winners in the building? All right, good job. So you get your special prizes. We have should I tell what it is? Should I tell what they are? So in first place, we have a fabulous water bottle that says what's on here? What does it say? Stay true, stay you. All right, so that's first place for Rebecca. Rebecca, congratulations, Rebecca. Nicely done. Second place, we have Cynthia. Have a nifty little fan that you put on your desk. Yes, it's getting to that time of year again, right? And then third place, I'm sorry, Brenda, not last. In third place, I hope you like puzzles, Brenda. Okay, fantastic. Enjoy your puzzle. Yexica was in fourth place. Oh, thank you for participating. So Yexica, when I return to Rhode Island, I will give you a candy. Yes. Everyone wins. Everyone wins. And I really appreciate the participation today, everyone. Just want to wrap up. And I know I didn't pause for much questions, but don't worry, I'll give you an opportunity, right? But I want to finish Ella's story. I hope you remember Ella had started the journey. She passed her step 1. Unfortunately, when she did step 2, she failed. Let's see what happened to Ella. Even though she was disappointed, Ella could not give up. Something didn't feel right. Ella had done everything right. She studied rigorously, improved her weak areas, and performed well on practice tests. Yet, the results did not reflect her true knowledge. Doubt gnawed at her. Was it nerves? A technical error? She wasn't sure. But one thing was certain. She couldn't accept it without a fight. With unshaken resolve, she resat the exam with even more determination. As she waited for the results, hours turned into days, and days turned into weeks. She decided that she didn't want to sit idly. And so she enrolled in a medical assistant class and became the instructor's right hand. So Ella was actually right next to the teacher. She was she actually helped the students with learning how to check pressure, how to check. So she was very handy with the clinicals. Thank you very much. And I remember the facilitator saying to me that I don't even know why she's here, but Ella needed to do something, right? And so because she didn't have a US license, her hands were tied. She wanted to help, she wanted to do something. And so she was determined to keep at it. Then one even, the email finally arrived. Her hands trembled as she opened the message. The message that she's been waiting on for weeks, she had finally passed. She finally got the green light to continue the journey. Tears filled her eyes. This was just one step, but it proved to be something greater. She was not defeated. She was still Dr. Ella Kaya, still the brilliant doctor she had been in Turkey, and she would not stop going. She would replace her place. She would reclaim her place in medicine because she wasn't just a doctor, she was a fighter, and fighters never quit. I just wanted to add to this. So Dr. Ella, her story stuck with me because she was sharing that after she when she did the test and she failed it, she was only a few months away from resitting the test. And it was so nerve-wracking for her because she hurried and she actually drove a mile. She traveled an hour away just so she can to reset the test so she could do it before the window for residency application, which is in September. She drove a mile away hoping she would get it back in time because usually you get it back in about 3 weeks. And it so happened that she wasn't able to get the results in time. She got the results like 2 weeks after the window closed. It was so she had to wait an entire year for the window to reopen to apply. So, but she's still going. She's still fighting. She's a medical assistant now. So I'm excited for her. I hope that she'll be able to get placed in the residency. But we know that once residency start, then that's not the end of the journey. She will still need to apply for licensure in the state. So, question? Okay, I have 4 minutes. You're overtime. I'm so oops. All right, ladies and gentlemen, I'm going to put my contact information here. Those are all the references. Just want to take the time to thank you for attending. Please, if you are aware of anyone, let's really share this information. We do need our IMGs. They are there, they're experts, they are ready to serve, and let's find a way to assist them because they are truly remarkable individuals. So my contact number is here on this final screen. If you have any questions, other questions, I have one that I'll need to respond. So please send me the email and I will be sure to respond to you quickly. Yes. Thanks, everyone. Much appreciated. Oh, good, good. That's very good.
I work at TNCC in Reno, Nevada.
Okay. Right. So warehouses, I've seen that a lot too. When we find our professionals, we try to get them out as quickly as we can because that is not good for their resumes. So if they volunteer in a hospital or in a nursing home or so on, that is actually way better for them. Right. Right. I love that. That's a novel idea. So if they continue work because they need to support their family and then volunteer, yes, because the more hours they can put in, the better, of course. But it doesn't matter how much they can put in. I would say as long as there's some hours there, encourage them to do it because a lot of our professionals, they're not even aware, because a lot of countries outside the US volunteerism isn't a big deal. So we find that it definitely encourages them to volunteer as many hours as they can. And you know what? A lot of times when people volunteer at organizations, they hire them because they are so, it's that network. So if that's what they can afford to do right now, definitely do the volunteering, and then they may be hired part-time and then eventually can find full-time employment. So at least I would say 2 hours if they can, you know, because unfortunately, when they put all the resumes in a pool, they're looking at the highest number of, you know, experience. So, but at least they have some there. I have not been privileged to. I do want to. Yes. Yes, it's definitely it's definitely one of the top ones. But again, you want to make sure that you check the area, their area. So in terms of if they're doing their specialization, because some states, the credentialing has to be done by certain organizations. So they may not necessarily accept the evaluation from WS. So there is a list. Why not make it a little more complicated, right? I don't have it with me, but I can connect you to the director at the Welcome Back Center, and she'll provide that. I think she's really good at it. So I'll stop sharing. It was.
So is it published?